Hello, this is the One Glove, One Purpose program. It is a training program that has two components. The first is infection prevention and control, and the other is antibiotic-resistant infectious diseases. If you are watching this video, which focus solely on antibiotic-resistant diseases, please look for the infection prevention and control presentation as well, because both presentation will help you understand the diseases as well as how to prevent them. Thank you so much. This presentation will focus solely on antibiotic-resistant infectious diseases. But before we start, let me introduce myself. My name is Martin Mengbeto, and I am Service Coordinator for the Department of Developmental Services, DDS. I'm also an intern in the Department for Training and Staff Development at Hogan Center, working in collaboration with NRS, the Northeastern Residential Services, to develop training program related to how to prevent drug-resistant diseases in the community. But before that, I used to be a direct care staff. Then I became a house manager and program coordinator. I also have a bachelor degree in community health, and I'm working on my master degree in public health, specializing in healthcare management. I also have I am certified health education specialist as well. This practicum or internship program allow me to research some drug-resistant diseases and come up with 2-part trainings. And this is one of the training that I'm about to record. I hope you like it and that you also review the other part of the training, which focus on infection prevention and control. Thank you. One Glove, One Purpose program is a preventive training program intended to increase the knowledge of the staff by raising awareness of antibiotic-resistant infectious diseases among the staff, identify resources available and techniques that will help to prevent the spread of germs and future outbreak, and empowering the residential staff as well as their supervisors to develop an integrated strategy to fight against antibiotic-resistant infectious diseases. Great, now we can talk about antibiotic-resistant infectious diseases. By the end of this first chapter, you will be able to identify some antibiotic-resistant diseases commonly found in the residential home, define antibiotic-resistant diseases, also known as multiple drug-resistant diseases, identify common cause, list some mode of transmission as well as a key method to treat them, identify at least 2 antibiotic-resistant prevention, disease prevention methods and strategy. Before we start, I would like to define some key terms that are intended to use throughout of this presentation. The first term is antibiotic. What is it, antibiotic? It is a medication like penicillin that try to stop the growth or destroy microorganisms, also known as germs. They are very specific to the target germs or bacteria. Antibiotic resistance germs are germs or bacteria that become resistant to antibiotics that will normally destroy them or kill them or treat them. Infectious diseases are caused by those microorganisms or bacteria or virus or parasite or fungus. The disease can spread directly or indirectly from one person to another. Colonization is when somebody has the germ on their body or some part of their body, but yet they don't have any sickness, they don't show any symptom of a disease. Carrier is that person who is contaminated. They carry the germs around, but they don't show any symptoms. Contamination is when something is contaminated. Air, food, water can be contaminated with harmful germs. Antibiotic can only work on bacteria, but not on virus or other type of pathogens. I just wanted to know that. Now let us talk about antibiotic-resistant diseases. What are they? They are also known as multiple resistant infectious diseases. They are pathogens or germs that can resist to antibiotic. They are well known in the hospitals and are called as hospital-associated infections. But now we can also find them in our backyard, in our community, and they are hurting people. They're treatable if the specific antibiotic is used. There are countless of them. Salmonella, E. coli, tuberculosis are part of this group. But me, I focus solely on C. difficile, Clostridium difficile, and methicillin-resistant Staphylococcus aureus MRSA, as well as for vancomycin-resistant Enterococcus VRE. In this presentation, I choose not to focus on VRE because I did not come across any incident of VRE during my practicum. And at this point, I'm doing evidence-based training, and VRE is not important for me to focus on at this time. But I want to tell you one thing. If you are doing everything to prevent C. diff or MRSA at your workplace, you are just preventing the occurrence or the spreading of VRE as well. So you shouldn't worry about it. So what really causes antibiotic-resistant infectious diseases? They are caused by harmless germs that become harmful when they get deep into our skin or bloodstream. These germs can live for a long time. Antibiotic misuse or overuse is also part of this problem. Excessive use of antibacterial products such as cleaning supplies, consuming products that is treated with antibiotics such as meat, vegetables, and once somebody develop antibiotic resistant diseases, it can now spread from one contact to another, from a caregiver's hand, from a hard touch surface, or sometimes bloodstream infection can occur during surgical procedure, and that's how the diseases are transmitted to other people. This slide is only showing you how antibiotic resistance happen. I've already explained to you before, and you can check it out again. Somebody who's healthy take antibiotic, and antibiotic end up killing good and bad bacteria. Or you eat something that is being fed antibiotic, or a health caregiver who failed to perform a good universal precaution get contaminated and share it with somebody who is healthy. All that can provoke antibiotic resistant diseases. Now that we talk about antibiotic resistant diseases, I want to now get to the specific of some of the disease. So we will talk about MRSA. By the end of the lesson on MRSA, you will have the ability to identify 3 sources of contamination of MRSA, 2 populations at risk, different type of MRSA, 3 symptoms of MRSA, and how MRSA is transmitted. You will also demonstrate the way to prevent MERSA and demonstrate the ability to disinfect a MERSA-infected environment. Before we understand MERSA, it's important to discuss a little bit about the germ that causes MERSA. It's called Staphylococcus aureus. It is a bacteria that lives on a healthy body as a normal bacteria and can be found in a groin, anal, armpits, under breast. Studies show that 1 out of 3 people carry the germ in their nose with no symptom or illness. Now let us talk about MERSA. They call it methicillin-resistant Staphylococcus aureus. You don't need to know. The bacteria Staphylococcus that I talked to you about become resistant to antibiotics like methicillin, penicillin, amoxicillin that will normally treat staph. And when they do, the medication will not work on MERSA. For the most part, doctors always find a way to treat MERSA effectively. How is MERSA tested? Usually people will swab the skin, or doctors or nurse will swab the skin and send it to the lab, and it takes 2 to 5 days for the result to come. Testing is very important because you cannot look at the wound and know that it is MERSA. It has to be tested positive before you think about MERSA. MERSA carriers are not always at risk to other people. People being admitted in the hospital must be tested. So if you have an individual who is required to have a surgical intervention, doctors might ask you to test them. It doesn't mean that they have MERSA. They just do this as a part of precaution to prevent infection from spreading. All right, who can be infected with MERSA? I think you and I, anyone can be infected with MERSA, whether we go to a hospital or in our community as shown in that picture. But if somebody has a weakened immune system, they are at high risk. If you have an open wound and you don't cover it, you can be infected of MERSA. Burn, cut, use of catheter, long-term skin condition, as well as surgery or ICU patient can get MERSA. So MERSA is one of the antibiotic-resistant infectious diseases. So it happens when staph get through the skin or bloodstream. And this can happen in various ways. Skin break, rash, scratch, contact with hard surfaces, fungal infection, bed sore, open cuts, airway, that surgical wound, catheter use, after misuse or overuse of antibiotic, or antibiotic taken without prescription can also cause MERSA. Failure to properly follow prescription of antibiotic is a serious problem, and that can cause resistance to germs that will normally be easily treated. So we must pay attention to that. How is MERSA transmitted? First of all, it's transmitted through contact, skin to skin, handshaking, or healthcare giver's hand. When somebody go to a crowded environment like a day program, sport dorm, prison, or healthcare facility, or even like swimming or exercising, they can be infected with MERSA. Sharing equipment is another thing that can promote the spread of MERSA germ. So blood pressure cuff, nasal spray must be disinfected before it's shared with another person. Contact with contaminated surface like doorknobs, phone, pen, need to be avoided because they can also help share the disease, the germ, I mean. And sharing personal items like towels, razor, washcloths, and clothing should be avoided, as well as participating in unsanitary tattooing practices, because those are the things that promote MRSA spread. What is the relationship between pets and MRSA? If somebody has MRSA, it's possible that their pet may carry. And usually people do all of the disinfestation and make sure that everything is clean, but MRSA keep coming. It's very important to check a dog or pet that you have to make sure that they're not transmitting the disease. But people have to know that the main important source of transmission of MRSA is from human to human. It's not really from pet to human. Another thing that is important for us to know to be able to plan a good strategy for MRSA prevention is the lifespan of MRSA. MRSA can live 8 weeks on mop head. When you mop the floor, if there's a MRSA on the floor, it can live on that mop for 8 weeks. 9 weeks on cotton towels, the towel that we use to wipe our hand or your body. That is why I suggest that you never shed towel in the bathroom as a way to wipe a hand when you wash your hand. 7 months in the dust, MRSA can live for 7 months in the dust, and 203 days, more than 6 months, MRSA can live on a blanket. So that's why it's important to wash the blanket right away and dry them hot. In the skin, MRSA can live indefinitely. Like I said, some people might be colonized, but they don't show any symptom. Now let us talk a little bit about the different type of MRSA. There are MRSA that we can get in the community, and usually it's on the skin, and there are MRSA that can be contacted in the hospital. That happens usually when people have surgical intervention. MRSA can get into the bloodstream and cause a serious problem. Otherwise, in the community, the skin MRSA is usually in the form of wound and can be treated easily. So the skin MRSA, which is usually we get in the community, can result in a wound that won't heal, bowel abscess, cellulitis, and the symptom can range from redness, swelling, tenderness, pain, discharge. Some people will feel not too well and they might have a temperature. Some of these infections can be confused with a spider bite. That's why it's important to be tested, because having all these symptoms doesn't mean that people have MRSA until they are tested for MRSA and have a positive result. The invasive form of MRSA is the one that usually get into the bloodstream, and it usually happens when people have a surgical intervention in the hospital. That is why doctors want to make sure that the person who has a surgery plan does not have any MRSA infection before they admit them in the hospital. The sign of MRSA, invasive MRSA, is high temperature, chilling, general feeling not unwell, dizziness, confusion, muscles ache, pain, swelling, tenderness, rash, fatigue, headache, chest pain, fever, chilling, and ailing feeling, cough or shortness of breath, or sometimes pneumonia. Because MRSA is people can have MRSA in different forms, there are also 3 different ways to treat MRSA. The first way is to treat the people who are colonized with MRSA. to decolonize them. That is easy. If the person is colonized, the first thing is to use body wash, powder to remove MRSA, cream to remove MRSA from the nose, and shampoo for hair. This MRSA and colonization does not require hospital admission. If that person do this and follow the doctor's instruction, they should be free from MRSA. Additional precautions include showering daily, use a fresh towel and dry them, wearing new clothes every day, and also wash bedding frequently, especially daily. The laundry should be washed and dry hot so that the MRSA can be killed, and also those laundry for infected MRSA person should be washed separate from all other laundry. Treating skin infection, skin MRSA, is the next step of treatment. If somebody has a wound that won't heal and is infected with MRSA, antibiotic might be prescribed, and it's very important to follow the instruction and take the antibiotic promptly. Also use antibiotic bacteria wash, powder, or cream if MRSA is in the nose. Wash clothes, pillowcases, and bedding frequently, at least daily, for at least 5 days. And if the wound requires drainage, healthcare provider must perform that. Now, if this MRSA is the severe form, like the cellulitis, or if the person is prone to infection, the doctors might use an antibiotic injection just to be safe and protect that person from other health problems. The invasive form of MRSA, which usually includes pneumonia sometimes, might be that one will require isolation. And if somebody has it in our group homes, chances are that they might be hospitalized and kept in isolation in a hospital until they're treated and then discharged. Anyway, just in case they do have it at home, the proper precaution will be advised to you with all of the equipment, and you need to follow the instructions so you can protect yourself and the individuals that lives in the household. This form might require long-term antibiotic injections as well as combination of antibiotic. There's an example of MRSA, invasive form of MRSA include blood poisoning, urinary tract infection that will affect the soft tissue sometimes, infection of heart valve, pneumonia, infection of the skin and joint or bones. So there are different types. It depends where the MRSA end up in our body, in the body or the bloodstream. Now that we talk about MRSA and how it is treated, let us talk about how to prevent it, because that is more important to me than the treatment. I don't want you to even have to experience MRSA. Instead, it's good to prevent it. So the first thing we need to do is to avoid sharing items between the individuals and clean up all of the high touch or contaminated surfaces. Report any MRSA or any cut or wound that you might find on the individual promptly, and make sure that if the wound requires drainage, that healthcare provider perform that task. Properly dispose of waste is another way to prevent MRSA in the household or the residential home where you work. It's also good to maintain good hand hygiene. Everybody who has come into contact with the individual visitors, individual family members, yourself, caregivers must wear gloves when they're caring for other people. Both hand hygiene, hand washing, and hand sanitizer are equally effective on MRSA. So if you do have hand sanitizer when you don't have soap and water, please use it. Protect cuts and bruises that you or the individual might have on them. And good cleaning care is always an important part of infection prevention. The last thing I want to talk about is the antibiotic. If you do have or the individual have antibiotic prescribed, make sure that all of the 5 rights are respected when administering that medication, and report any problem to the doctor or the nurses that work with you. Please, please, please go back and review the presentation on infection prevention and control for further detail about how to prevent MRSA at your workplace. Great. How are we doing? We talk about antibiotic-resistant diseases, and we just finished talking about MRSA. Now we will talk about Clostridium difficile, also known as C. diff. By the end of this presentation, you will be able to define what is C. diff, describe the symptom of C. diff, describe how C. diff is transmitted, describe outcome of C. diff infection, and explain at least one strategy that will help you prevent C. diff at your workplace. So what is C. diff? C. diff, they also call it CDI or CDAD, is antibiotic-associated diarrhea caused by bacteria that lives in our stomach and intestine. It is well known in the hospitals, facilities, and the bacteria of C. diff become a problem when the antibiotic used to treat other diseases go ahead and kill both the good and the bad bacteria, causing the C. diff bacteria to grow out of control. This toxin then start causing diarrhea, and C. diff become a problem also in the community. And now we can find C. diff in a school, gymnasium, and sport locker, as well as prison. So in order for us to talk about C. diff properly, we need to know the germ that causes the disease. And it is a germ that can live on the surface for a very long time. It's a bacteria that is resistant to heat and acid. It is a germ that lives in 2 different forms. It can be very active in the stomach and causing severe or almost deadly diarrhea, or it can live in a form that sleep for a long time either in the stomach and intestine or in the environment. Outside of our body, it forms a hard cover to protect itself so that nothing, including hand sanitizer, can kill it. Now, who's at risk of getting C. diff? If the person is exposed to antibiotic or to another infected person, or if they have a gastric acid suppression as well as gastrointestinal surgery or long-term stay in the hospital or healthcare facility can also increase a chance of getting C. diff, as well as a serious underlying illness and weakened immune system that usually happen among people with cancer or HIV. We can also Somebody can also contact C. diff if they are on G-tube, or if they are a little bit older, because of, again, the weakening immune system get factor into the reaction of this germ. Some signs of C. diff include watery diarrhea, fever, loss of appetite, nausea, abdominal tenderness, and cramps. If somebody has diarrhea for 3 days with fever that won't go away, it's important to have them tested right away to make sure that they don't have C. diff. The symptoms of C. diff include severe inflammation of the colon, severe enlarged colon, weakened bowel wall causing perforation and leak from the gut flora into the bloodstream, blood infection, as well as possible death. Great. This chart indicates how someone can get C. diff and how C. diff can be treated and the outcome. So the guy on top is the same guy. So he may have a C. diff germs, mean he's colonized, but show no symptoms. Or he may have C. diff and then he get treated and then he feel better for good. Or he has a C. diff and they treat him, but then the C. diff keep coming back and back and back and back for a long time. So that's how C. diff works. Doctors use different ways to test C. diff. The most common is the stool testing, but there are other testing that is done with a molecule or tox. They use the blood to test to see if the C. diff infection didn't reach the bloodstream yet. So there are many ways that C. diff is tested. Okay, this is a Bristol stool chart to show you what type of stool to pay attention to. If the stool look like number 4 or 5, it is normal. If it look like number 6 and 7, and the person also has fever, you should have them tested for C. diff. Once somebody has C. diff, it's very important to contact the doctor so the medication can be reviewed promptly to see if there's any antibiotic that need to be stopped, or laxative or stool softener that need to be put on hold to increase the chance of healing. If the C. diff is severe type, the doctor might require surgical intervention as well as a stool transplant to improve the chance of healing. The vaccine is still in a work, and there is no vaccine for C. diff at this time. As you already know, diarrhea is the main symptom of C. diff. On this slide, I would like to talk a little bit about C. diff and nutrition so you know what to do when somebody has diarrhea or C. diff. It is recommended to have liquid diet for at least 3 days to see if the diarrhea will stop on its own. Otherwise, please avoid whole milk or milk product as they might cause stomach upset. Also, C. diff can cause lactose intolerance, so it's important to avoid lactose dairy products and use substitutes. Avoid greasy food and food high in fat contents. Avoid food that are hard to digest like broccoli, cauliflower, whole grain breads, onion, beans. Avoid raw food as well as spicy food and caffeinated food. Some fat-free food might also be required to avoid. For better understanding of this subject, please consult with nutritionist or doctor to make sure that you are doing the right thing for the individual that you support. Now, before we talk about C. diff prevention, I would like you to watch this video clip before we move on.
You may think I'm a movie star, but I'm just a good-looking bottle of bleach with a killer benefit. I'm the only common disinfectant that kills Clostridium difficile, better known as C. diff. One of the scariest things about C. diff is its ability to live and grow on contaminated surfaces for months. This is why housekeeping and environmental services staff play such an important role in keeping patients, visitors, and healthcare workers safe. People can become sick if they touch items or surfaces that have been contaminated with feces and then touch their mouth, nose, or eyes. Anyone, including healthcare workers, who touch contaminated surfaces can spread C. diff to others. To protect patients, visitors, colleagues, and yourself from C. diff, carefully clean patient rooms with a bleach-based disinfectant, like me, because I'm the only one that can kill C. diff. First, protect yourself. Unfortunately, hand sanitizers don't kill C. diff. So before you enter the patient's room, wash your hands with soap and water. Next, put on your personal protective equipment. Gowns, masks, and gloves. Empty the trash and remove the soiled linens. Then, using a bleach-based disinfectant, carefully wipe down all surfaces that patients, healthcare workers, and visitors are likely to touch. That means wipe the doorknobs and the door handles. Wipe the light switch. Wipe the telephone, both buttons and receiver. Also, wipe the call button control. And any IV or other medical equipment controls. Wipe the bed rails too, and any other flat surfaces. Wipe the arms and seat of the patient's chair and any other furniture in the room. Make sure to wipe the over-the-bed table too. Because C. diff is transmitted through feces, it is especially important to carefully wipe all bathroom surfaces with a bleach-based cleaner. It's really important to wipe the bathroom light switch and door handle. Wipe down the shower and bathtub. And don't forget bathroom safety rails. Using the bleach solution, clean the mirror and sink, including the faucet. Then, wipe off the toilet, starting with the flush lever and finishing with the toilet seat. Now you can clean the rest of the room. When you finish cleaning with the bleach solution, switch to regular cleaning supplies. First, dust mop, then wet mop the floors. Use a damp cloth to dust the TV and stand and bed frame. Since we don't want the next patient to be infected, special cleaning must happen whenever a patient is discharged. This is known as terminal cleaning. In addition to the cleaning steps we've just reviewed, you must also damp dust the bed frame, the mattress cover, pillows, and any other surfaces. Once you're ready to leave the room, remove cleaning supplies and throw away used wipes and cloths. Then, replace the hand sanitizer and paper towels, and replace the trash liner. Remove your PPE and gloves and throw them away. Then, wash your hands with soap and water. Now that the room is clean, you can prepare for the next patient and make the bed. As you can see, with just a few easy steps, you can protect patients, visitors, co-workers, and yourself from dangerous C. diff bacteria. Always remember to use the bleach-based cleaning solution. Wipe down any surfaces that patients, visitors, and caregivers touch. And protect yourself with gloves and PPE. You play a key role in keeping patients safe. Remember, you're not just cleaning rooms, you are saving lives.
Now that you've watched this video, I hope you learned something from it and that you will use it to improve C. diff prevention at your workplace. In addition to this video, I want to talk to you a little bit about what to watch for when preventing C. diff. First, anyone can get C. diff. You can get it in the community or you can get it in a healthcare setting. C. diff germs can live in a gut flora, on our hand, or high touch surfaces. C. diff germs are resistant to heat, acid, and therefore to hand sanitizer. C. diff germs can live for months. Now, how do you prevent C. diff? First, pay attention to the antibiotics and the instructions that comes with it, and make sure you follow all of the 5 right when giving the medication, and never stop until you have a new prescription that authorizes you to stop. Observe contact precautions all the time when somebody has C. diff. Use gloves when caring for somebody, the individual especially, and wash your hand before and after you use gloves. Perform cleaning of shared equipment all the time, especially blood pressure cuff, and other shared equipment. Do not share personnel items, and maintain these precautions all the time, especially when somebody has C. diff, until this diarrhea stops. Develop a good environmental cleaning strategy at your workplace and work as a team to maintain that. And remember, hand sanitizer will not kill C. diff germs, so please don't use it if you believe that there's a C. diff infection around. The important thing to do at that time is to wash your hand properly and all the time. Hand wash is the best when it comes to C. diff germs. I hope you learned something from this, and remember to wear 1 pair of gloves for one purpose only, because prevention is better and cheaper than treatment. I hope you liked this video presentation and that you've learned something that will help you improve infection prevention at your workplace. Please check out the infection prevention control video as well, because it's the combination that will help you to understand about these diseases and how to prevent them. Thank you very, very much, and I hope you do everything in your power to keep yourself, your loved ones, and the individual safe from germs. Thank you.